One of the things that's complicating issues in India is the outbreak of mucormycosis, otherwise known as black mold. This mold is just about everywhere. It's found in the soil, and some experts believe that the steroids, which reduces the immune system and also increases the blood sugar, is providing a recipe for the invasion of this fungus, which is typically seen in patients about 2 to 3 weeks after they recover from COVID-19. In this BBC article regarding this, they report here that there was 58 cases of the infection that happen usually 12 to 15 days after recovery from COVID-19, and that there have been 24 cases in the past 2 months, which was up from 6 cases a year in the past. But why has this happened in India but not other countries? There's an article in India Today that might shed some light onto potentially what is going on. They say here that the main reason is prolonged unhygienic oxygen delivery to patients combined with indiscriminate use of steroids. And part of the issue has to do with the lack of oxygen supplies in these countries where the healthcare system is overwhelmed. They say here that there's a vast difference between medical oxygen and industrial oxygen. Medical oxygen is a highly purified version that is more than 99.5% pure and is prepared through repeated steps of compression, filtration, and purification. The cylinders in which the liquid oxygen is stored, transported, are rigorously cleaned and disinfected. This oxygen requires humidification before being administered to patients, so it is passed through a container filled with sterile water. And that's the key word there, is sterile water. The water itself must be sterilized and changed frequently as per protocol. If the water is not sterile, it is potentially a source of the black fungus infection. The fungus infection is typically starting out in the sinuses and eating its way through into the bone, into the eyes, and potentially even the brain. So, of course, the recommendation would be to make sure that blood sugars are checked when the patients are on steroids, to make sure that we don't have out-of-control diabetes, to make sure that we're using medical oxygen, and to make sure that the humidification is through the use of sterile water. Based on the information that we currently have, these steps will help curb the increase in this mucormycosis or black fungus surge that we're seeing in India.